Hi, I'm Deborah Quilter and welcome to RSI Help YouTube. Jim Harwood is an osteopathic manual practice physical therapist, and he's the co-owner of New York Physical Therapy. And uh, I wanted to talk to him about cranial work. I once had the most amazing experience with Jim. Um, in cranial work, they work on the bones of your face, and it was just an extraordinary learning for me because by these gentle movements of my head, I felt like the inner ear canal was opening up, my eye was opening up, all kinds of these marvelous things were happening to my upper extremity. And I just would like Jim to explain a little bit about cranial work and how it works. So welcome back to the show, Jim.
Thanks, Deborah. I appreciate it. So cranial osteopathy or craniosacral, basically it's just another tool within the bag of or the toolkit of an osteopathic practitioner. Um, it turns out it's one of the most important ones within osteopathy. The quick history of it is osteopathy was started by a man by the name of Andrew Still back in the Civil War time. Oh my goodness, I just got it. But it ended up happening. It's an interesting story actually, because the whole point of the cranial work, it does come back to breath and breathing, not necessarily thoracic breathing, but there's a certain component of the cranium that has a breath. And Sutherland was walking one day in a lab. He was walking by the lab and he happened to see a temporal bone. The temporal bone is the bones on the side of your head right above your ear. He literally saw it sitting out like it was, to learn the anatomy. And he recognized that the squama, which is the outside part of it, sitting out, it looked like the gills of a fish. And he couldn't help but think, wow, that almost looks like that bone can breathe. And it kind of led him on actually a lifetime journey of understanding this idea of craniosacral osteopathy and all the different components of it that has branched into a remarkable talking, Deborah, specifically so there is certainly a mechanical piece to this, right? So you have all these bones, right? You have your two temporals, you have two parietals, you have an occiput, you have a sphenoid, you have an ethmoid, you have all these bones of the cranium. And despite what some people might think, that once the bones fuse, because you have the sutures around your cranium, there are some people who believe there's no movement, but I don't believe that. And even if there was no movement, which I don't believe there isn't, there's still living tissue, and living tissue has an inherent movement in and of itself. Even if it isn't moving in relation to another bone, which I believe it does, it still has a breath. It's living, and you can in treating the cranium, you learn palpation skills that kind of look at it on many, many different levels. So you can look at it at a mechanical level, right? So a good example might be what you said, the draining, right? So we know when we're born, the way the cranium is set up, the temporal bones are in such a angle. Their positioning causes the eustachian tube and the canal between the ear and the throat to be more horizontal. So we know that kids are more susceptible to ear infections early on because of that horizontalization, if that's the right word, of these canals. But we also understand as we grow and grow normally, those bones start to move and they start to become more vertical. And when they're vertical, they have the ability to drain. So for instance, when we hear that a child is going to go for tube surgery, we often, we hope or suggest, if we can, that they might decide or to get cranial treatment to make sure that temporal bone on that side or both sides is not blocked and not allowing that normal development of the temporal bone and all its components, so that canal has the natural ability to get more vertical. And you'd be amazed, man. You can get on those and you realize it's blocked. It's just stuck. And through cranial treatment, which is kind of hard to describe exactly what you do, other than anywhere in the body where something is blocked, there are certain techniques we learn to free it up. It just in that capacity, it's called craniosacral because you're working within the cranium, and it's amazing. I mean, it's incredible. But some of the other benefits that you started to allude to as well is the systemic impacts, and there's a lot of reasons for that. One of them is the connection of the dura from the cranium down to the sacrum. Sutherland talks about the potency of the cerebral spinal fluid. This gets a little out there, in understanding, but as an osteopathic manual practitioner and understanding the um, craniosacral model, we do believe that within there is an ability for the body to be better at healing itself if that system is free. And I don't have the time to go into all the pieces of that, but just understand the way the cranium moves, the way the sacrum moves, and the way the dura is attached to both ends is very important from an osteopathic standpoint of a person's ability to heal.
Jim, can you explain the dura? I think you're talking about the dura mater.
I am, actually, exactly. So if you look at the central nervous system, right, the brain and the spinal cord, that's your central nervous system, as opposed to the peripheral nervous system, which is all your nerves, your sciatic nerve, your ulnar nerve, your radial nerve. I often think of it this way. I may be showing my age, but the AT&T or the main building is your brain and your spinal cord, and all the nerves going out is like the wires going to your house, or the old days. So within that central nervous system, we have a specialized type of tissue that surrounds the brain and the dura. I'm sorry, the spinal canal, the spinal cord. There's three layers, right? There's what's called the pia, the arachnoid, and the dura. And basically, these are just the layers of the meninges that go from the brain out. The pia mater adheres to the brain and the spinal cord. The arachnoid is the next layer, and then you have the dura. Some people may know the word dura when they hear of an epidural shot. All that means, it's basically telling you the geography, right? So the doctor is injecting in the spinal canal. When it's epidural, it just means that injection it doesn't penetrate the dura. And so it stays outside, in effect, the central nervous system. A spinal would be something that pierces the dura, and now it's within the spinal canal. But so the dura basically is that outer covering. It tends to be very strong, and but it has this relationship with the neural tissue. It has a relationship with the cerebral spinal fluid, and again, it would be really difficult to try to explain every little piece of it. I think if people just understood that if you're being treated by someone who's learned the osteopathic manual practice and they're using craniosacral as a modality or as a treatment model, part of it is the mechanic, right? Making sure those bones are all free and moving. Part of it is also understanding that motility of that system, not mobility, motility is very important. So like if I'm treating, again, almost every single person I treat, irregardless of what they come see me for, I'm going to analyze that system because that system tells me a lot about whether this person's ability to heal themselves is at its maximal state, or can it be better. So if I had somebody who had a real bad ankle, I always go the furthest away, and I got on their cranium and the cranium was blocked, the periphery is not going to respond well to the central issue. So the first thing as an osteopath, again, I got to be careful, physical therapist with an osteopathic approach, is to make sure that system is as free as possible, knowing that is going to be a big part of the healing process, irregardless of where you're working. So I don't know if that helps explain it.
It helps a lot. I mean, we could talk about the cranium all day long, but unfortunately, I know you have an appointment, and as much as I'd like to continue, we'll have to pick this up another time. Thank you so much for coming. How can people find you, Jim?
So you can reach out. Reach out. You can, this is during COVID time, so reaching out would be you have to call me on my cell, or you can email me, which is jim@nypthealing.com. The website is www.nypthealing.com.
Thank you so much. And thanks everybody for watching. And we hope to have you back on the show soon, Jim. It was really fascinating. And please subscribe.